Hi, I'm Christy Quigley, president of ClaimLinx. We are a full-service insurance consultant agency and third-party administrator. Today I'm going to show you how ClaimLinx saves small businesses all over the country millions on their health insurance. ClaimLinx started in 2004. Tom Quigley, who was a small business insurance agent at the time, was getting frustrated with the spiking costs he was seeing. At the same time, I was working at Anthem Blue Cross and Blue Shield as a marketing analyst. I was seeing why the rates were going up and how the industry was changing. Together, we came up with a solution to save business owners 20 to 40% on their health insurance. Since then, we've helped thousands of companies take their health plan from their second highest expense to their fifth or sixth. So, let's start with talking about regular group health insurance. What major medical carriers don't spell out is that your insurance premium is a bundle of services. That includes medical claims administration, payment to a pharmacy benefit manager, and prescription administration. And most importantly, prepayment for medical services. Insurance companies make an estimate of how much people will go to the doctor throughout the year and charge based on that. But what I saw was that people don't use the plan as much as insurance companies expect. Let's take this concept and apply it to another type of insurance you're familiar with, car insurance. People have car insurance plans in case of an accident or damage, events that are very expensive. They don't use their car insurance for regular maintenance like oil changes, new tires, or yearly service. Think about how much more the insurance company would charge if they covered these things too. It's the same for medical insurance. The prices balloon because they're covering lower cost services. We concluded there was a lot of companies' money being wasted in that big insurance premium. So we created a simple option solution. It breaks down your health plan into smaller pieces so you can get the most out of every dollar. Now, let me take you through the steps so you can see a plan in action. The first step is making a change in how you think about your plan. Just like with car insurance, you want to only be paying insurance companies for catastrophic incidents. How we do this is by raising the deductible. This policy includes coverage for essential benefits and preventive services and offers discounts on visits, procedures, and prescriptions. Basically, when you're buying a major medical plan, you're buying a provider network. That and peace of mind for big medical expenses. So, how much of a difference does this make? You can see in this example that right away, raising the deductible cuts costs significantly. For this plan, going from $1,000 to a $5,000 deductible for a single saved 45%. But that's not the end of setting up the plan. Even though raising the deductible means cutting costs, it also means cutting benefits people like, such as copays and other small cost sharing. But those can be added back in. So next we set up a medical expense reimbursement plan, or a MERP. What is a MERP? It's a type of self-funded plan where an employer agrees to pay for medical services according to a schedule of benefits. It uses an almost 70-year-old tax code called Section 105 that lets business owners pay for employees' medical services tax-free. This is how you would keep your workers and their families happy by buying back the benefits that they're used to. What's great about the MERP is it can include copays, coinsurance, and/or a lower deductible at a fraction of the cost. ClaimLinx customizes the schedule benefits to mirror your current plan. That way, there's no disruption in coverage or benefits for the employees. But what's really important is that you're only paying for services used instead of prepaying like in the old plan. So, let's look at the overall picture. You have the high deductible plan with the major medical carrier. Our example has a $5,000 deductible for a single. Next is the MERP, the employer's responsibility. That's funding for medical expenses minus any copays, coinsurance, and/or a lower deductible. The last piece is the employee's responsibility. That would be their deductible or any other cost sharing. All of this comes together for a complete plan. The ClaimLinx solution just changes the financing. It offers the best benefits at the lowest cost. How does splitting the plan into a major medical policy and a MERP save so much? It's simple. Employees don't use the plan as much as you think. Only about 2 to 8% of people exceed their deductible every year. Reaching a plan deductible usually coincides with some sort of major event. Not that many people have this happen every year. The last piece we're going to talk about today is drug coverage. We know medications are becoming more and more expensive. At the same time, they're becoming increasingly important to people's health. That's why, with each client, ClaimLinx takes a look at their prescription usage. We find coupons, public programs, grants, and alternative plans. We look for pretty much anything to cut costs to the company and worker. Let's take a look at a real-world example of all of this together. This sample client is a heating and air conditioning company. They have 49 single members and 30 members with dependents. We put the employees on 2 different high-deductible plans and added a MERP to mirror their previous benefits. Then we also included the prescription coverage to mirror the previous plan. Keep in mind the ClaimLinx solution offered the same benefits as the group plan, but as you can see, it cost 27% less at the end of the year. So that we took the cost of their health plan from almost $790,000 to $573,000. That includes the cost of premiums, MERP, prescriptions, and administration. Savings vary from company to company, but this is pretty typical for one of our clients. So what do you do with all that savings? We've seen clients invest in their business with the extra cash. In many cases, we are talking about thousands of dollars per employee saved. So you can see how it can add up pretty quickly. Some of our clients have been able to hire more staff, renovate, or buy new equipment. More often than not, the first thing we see is companies improve benefits. That can mean lowering copays or adding extra coverage like vision or dental. Or we also recommend offering supplemental coverage if you don't already. I just showed you how the ClaimLinx solution works. Here are the important things to remember. With our plan, you're no longer prepaying for services employees may never use. Every client gets a customized schedule of benefits that mirrors their current plan. That means no disruption in benefits for employees. And lastly, our solution saves clients a minimum of 20% on the health plan. That's money you can put back in your business right away. Contact our office to start a free consultation or find out more at ClaimLinx.com. We would love to talk to you about your current plan and what we can do for you. Take back control of your health plan and start saving today.